Hey everybody, I'm Leanna,
I'm Tammy.
and welcome to our channel, Tammy and Leanna, where we talk about inspiring women over 55 to live their best life.
This time we're going to be talking about some healthcare options because insurance is part of what we need as we're aging. And so I just came up with some healthcare options for us between the ages of 62 and 65 because we're not able to get the Medicare until age 65. Some good options are to look into the marketplace. This is based on your income. That's what the cost will be. The pros are that it's widely available, that you'll be able to use it in most doctor's offices. And the cons are that the plans could have a high deductible. So if you are a healthy person, having that high deductible is okay because it would mostly just be used for something if you were to have something catastrophic happen. That is an option, is the marketplace, to check that out. The number two would be something that I use is my partner. His work actually has insurance for, they recognize the common law marriage. And even though we're not legally or technically married, we are together as a couple for over 7 years. So I'm able to get onto his health insurance plan. So that's very, very helpful. But check with your spouse or your partner's health insurance plan because that might be a really great option for you to be able to get the coverage that you need. The pros are that it's usually more affordable than an individual plan, and the cons are that you have to wait for open enrollment if you're going to join onto your spouse or your partner's plan, or you can ask if you can join in a qualifying event, like if you lost your coverage. So then that's an option to get into the spouse's employment plan, health and plan. So now the next one is the Medicaid, and this is based on low income and the state. Also look at the state that you live in for this option. And the pros would be that it's comprehensive and it's free or very low cost. The cons are that it's income and asset restrictions and it's limited doctors and networks. So the Medicaid is based on your income and also where you live, possibly. So check your state rules on that option. And then the last one would be the private health insurance, which the pros would be that it has a wide choice of plans that you can choose from, and which would have high deductibles, low deductibles, and also they might have some options like joining health clubs, silver sneakers, things like that. The cons with this option is that these plans may not cover the pre-existing condition. So if that's something that you need to put into what you need, that would be a con. So those are some options to look into. Now, the reason why I also wanted to talk about this is that when I signed up for my Social Security a little early, when I turned 65, they sent my Medicare card and also saying that they were going to take $185 out of my Social Security check. And I was so frantic because that's a lot of money. And also because with my budget, I wasn't ready to have that amount taken out. So I said, why do I have to have that? Because I have health insurance. So I had to call and I had to talk to them and show that I have proof of insurance, because a lot of I was reading and it says, oh, if you don't sign up, you're going to get a penalty. And the longer you wait, the more penalty you could have. Later on, I talked to the Medicare office, and also did my own research, and it says you can delay enrolling in your Medicare Part B without penalty if you have credible coverage. And I do, because I'm on my partner's employer health plan. So just make sure that, if this happens to you, I just want you to advocate for yourself, show that you have your own coverage, and you can actually waive that until you actually need it without having to pay that monthly payment, because that's a lot of money. And so when you leave your job or you lose coverage, you can get an 8-month special enrollment plan. They call the SEP, special enrollment period, to sign up for the Medicare Part B without a late penalty. So that's also a good option to know. And so to have the credible insurance, you need to be with an employer that has more than 20 employees, excuse me. So then that falls in with my situation. So these are some options that I wanted to share with you, and some also my personal story that received the $185 bill for the monthly insurance. And so now I think Leanna's going to talk to you about some options that she found about part-time jobs, employers that would offer healthcare for you. Leanna?
Yeah, hi, thank you. So many people are going to have a part-time job when they retire, especially if they try to retire at 62. So you can kind of kill two birds with one stone. You can make a little bit of extra money, and then you can also join in a work-sponsored health insurance plan. Now, you'll have to pay for that plan. They're not free, but there's a whole list of companies that I found that do this, and how they make it work is through using group plans. So and those group plans do require a minimum hourly threshold. So most of the time you have to work 15 to 20 plus hours a week to qualify for the health insurance. And I'll just list some of the companies. There's Chipotle, there's Costco, and that's about 23 hours a week to qualify for health insurance. There's Lowe's, which is about 20 hours. REI is another company, Staples, Macy's, UPS, Trader Joe's, and some of the federal government jobs, but they have to be permanent status positions. So you just have to investigate and find out what type of work would work best for you and what they offer. You want to check for what are the required hours? How many hours do you have to work a week or a month to qualify for health insurance? What's the eligibility timeline? If you started a job, how long do you have to work there before you can pay for coverage? What's the coverage level? How much health care do you need? Do you need paid nurses? Do you have dependents? Do you need mental health coverage? You just need to research that type of thing. And then what's the benefit type? Is it a traditional insurance or is it a HRA? And so you might have choice of both, and you'll just have to see what works for you. And then, like Tammy said, there's also a health insurance marketplace. And I did find something called the Freelancers Union, and they provide group plans and insurance for part-time and gig workers. So that's another option.
Great. My employer I work for, I'm a school crossing guard, and they offer health insurance as well. And I'm only working 2 hours a day. And still, since it's through the sheriff's office, that they do offer us health insurance.
Well, that's great.
Yeah, so it's surprising that you're only working that little of hours and you're still offered that coverage. Fortunately, I'm on my partner's plan, so I don't need it. But if he were to retire, which I'm sure he will at some time, then I have that option that I can go into that employer's healthcare coverage. So, and I'm going to have to compare the prices on whether that's the coverage and also the cost on the Medicare coverage versus the employer coverage.
Yeah, it's really interesting how Social Security works with their benefits and the health insurance. I didn't know until we started talking about this that you even could refuse it.
I know.
But I didn't realize you paid for it either. I thought it was free. So this has been a big learning curve.
Well, the hospital portion is free, and I did take that, but the medical for doctors, that's not free, and that was a huge cost. And it really woke me up to think when when we were younger, we said, oh, people on fixed incomes. I really get it now. Every penny counts, and talking about every penny counts. Next week will be a great time that we can start talking about budgeting and strategies that we have used or we're looking into using to help our budgets and to help you with your budgets. And let's look at some ways that we can save money.
So, y'all, I'm going to be the guinea pig for that. I really spend a lot of money on food. So I used Chat GPT to figure out a budget with my income and my expenses, and it's told me how much a week I can spend on food. So that's what I'm doing now. But I'm going to go back for a month or two and total up what I've spent in food in a month. I don't care that y'all know. I've spent upwards of $1,200 a month on food at some point. So I can't do it anymore, right? If I want to quit working. So I'll bring it all to you next week and let Tammy dissect it.
We just really have to rein some things in and our needs and our wants and just readjust things because at some point we're going to talk about all the fun things we want to do and
Yeah.
how to do those because we both love travel and at some point we'll be talking about how we can make those dreams happen too.
Yeah.
Sure.
It's a good journey. We're having a great time
I know.
and we're loving doing this YouTube and we've only just started. So we do recommend that to you too.
Yes,
And
definitely.
have some shows about that because there was a bit of fear involved and just normal concerns I think anyone would have. So
Yep.
anyway, anything else today, Tam?
That's about it for me. And I'm just super excited to continue on this journey with you and with viewers. And we're just two regular girls just trying to live our and learn from our mistakes for sure. And look forward to having a great future, being healthy, happy, prosperous. So we thank you for your support and continued support. And I look forward to sharing this journey with you.
All right, we'll see you next week. Thank you so much.